Informed consent. When you're about to go through a surgery or a procedure, your doctor is going to explain the risks and the benefits of the procedure and have you sign a document. But what exactly is informed consent? When you decide to go on a procedure, the physician is going to have you sign a document that's usually dated, timed, has lists of witnesses, family, friends, and office staff present who will also sign. And that particular document is basically to disclose all the risks and benefits to you of going through the procedure. Usually, when a patient decides to go through a procedure or surgery, they're given an entirely complete and very thorough list of possible complications. Don't be alarmed, this list is often very long and can include mild complications from even more serious ones such as death, which is always a possible outcome but incredibly rare. Now, the reason they have to discuss these risks, even though they happen very minimally in most of the population, is that they want the patient to be informed in the case these are to happen. Now, while they're also explaining the risks of going through the procedure, they should also be explaining the risks of not going through the procedure. For example, let's say in a certain instance you were found to have a lesion or an abnormal finding on a chest x-ray and your physician recommends a biopsy. Okay, the surgeon or the pulmonologist goes through all the possible complications of the procedure with you, but you decide to back out. They will also explain the risks of not going through the said biopsy in this example, such as an impact on your disease prognosis and further management options. But the idea is that you are aware of all the risks of going through the procedure and not going through the procedure to make an informed decision. Now, while this is occurring, keep in mind that just because you sign the document doesn't mean that the physician is completely absolved of any liability. For example, let's say medical malpractice was performed and something went wrong. The physician's performance of the procedure will be scrutinized, and if the complication was found to be a product of malpractice, then you have a case. But this is incredibly rare, and a lot of times the informed consent process is designed to help protect patients and help give them a chance to ask questions. Don't hesitate to ask the questions. Often what we see is patients are timid or don't feel like they understand and are afraid to make their ambiguity known to the physician. We encourage patients to ask questions, ensure that you understand what's going on before you embark down that path. Again, I'm here to help answer all your questions, and until next time, we'll discuss informed refusal.